Okay. Hi, Ian. Thank you so much for joining us today for a spotlight interview. I'm super excited about this interview and I hope everyone will enjoy it. And I know they will. So basically, yeah, we'll just get started. So Ian, what sport were you and when did you graduate from Stanford?
I was on the football team. I was at Stanford from 93 to 97. Graduated 97.
And then what did you study?
I was a biology major and did biology with an honors thesis looking at rotaviral infection of all things. So,
Mhm. How was your undergrad experience balancing being a student athlete, also your major, and prepping for med school?
if anything, actually, sports. So I was a walk-on. I was not recruited, which is something that happens when you're only 5'7" and slow. But so the thing that was nice about it was that it actually helped me academically to play sports because it made me really look like regiment my time much more efficiently and effectively. And I realized how much of my time was not really being spent doing anything. And when I had to basically make all the meetings and do all the things and get everything done by a certain time, I was like a lot more on schedule. And so my grades actually improved with football.
Wow.
So yeah,
When did you walk onto the team?
I walked on at the during the winter of my freshman year. So yeah.
Gotcha. Did you always know that you wanted to go into medicine? Like, was that something that you knew going into Stanford or something you figured out along the way?
I liked medicine, but I actually wanted to be a researcher as a kid. And I wasn't sure about medicine. But I think the thing about medicine was it was very intimidating. And I was a little bit afraid at first because I saw that it seemed like everybody wanted to go into medicine. And the number of people that ended up dropping it was so high that I was like, that seems a little scary. But when I realized that it was actually my fear that was really causing me to hesitate, I didn't think that was a very good reason. And I think that the one thing that was really great about sports was you get used to competing on a level with people who are really excellent at what they do. And when you find that you can do that on the field, it actually, for me, helped me a lot to feel that same way in the classroom. And so I showed up to Stanford on the very first day, having never done a visit. We didn't have very much money or anything like that. The first time I ever saw the campus was the day that I brought my stuff and went to the dorm. And so I just knew it was going to be a good school, so I was going to roll the dice and take my chances.
Yeah,
Uh,
you
and
made a
so
good bet.
exactly. But when I got here, at first it took a little bit of getting used to, but I think that things like sports and competing and being on that level made me feel like I could stick it out. And that actually helped me with medicine as well. And when I realized that it was just that kind of concern, I was like, oh, well, I'm going to do that. And so I did it and I just stuck with it.
Yeah. And so, what did you do in undergrad to prep yourself for like medical school applications or anything? And you went on to do an MD PhD. So I'm assuming you did a lot of research. So what was that like navigating like what you chose to do while you were an undergrad?
Yeah, sure. So the first thing that I had to do was find a lab. I knew I wanted to do science and work with, doing bench research. And I was all for it. I really liked that. So I had to find somebody who would either take me in the lab or hire me, which was actually at the time a little bit harder than I thought. But I ended up in the lab of a guy by the name of Dr. Harry Greenberg, and he was a virologist. He studied different types of viral infections. And I got involved with a project looking at a virus called rotavirus that causes childhood diarrhea around the world. And we were looking to see the determinants of immune protection so that we could help design a vaccine. And I was instantly hooked. And I always liked the idea of immunology. And so I basically stuck with that. I think as an undergrad, I actually managed to complete the graduate coursework for both the immunology and the virology PhDs during my senior year.
Oh my
Um,
gosh.
I loved it so much. So
Mhm.
that was where I got my extra credits in. I just did all that stuff, and so that was really helpful.
So you were going through all of that. Did you know you wanted to do the MD PhD all along through undergrad?
I did. I will say this though, and this is important. A lot of the MD PhD programs are very highly competitive, and so it's extremely hard to get in them without having a really extensive research background. And I was not super competitive for that, but a lot of times, once you are able to get yourself into med school, there are other avenues by which you can join the MD PhD programs.
Mhm.
And so I managed to get myself into med school first. And then I sought out another program. So there's the MSTP program, which is one thing, the medical scientist training program that is very well known. Everybody knows about that. And you sort of apply for that right away. I was not competitive enough to get into that program, but there was another program at our institution called the Pediatric Growth and Development Training Grant that took students that were already in med school. And so I applied for that. Um, Usually, by the time you get into medical school, people have sort of made up their minds. So there weren't that many people applying for that program, and
Mhm.
so it was a much easier way to get into an MD PhD program, and that's what I did. Uh, However, once I got in there, they don't make the PhD any easier for you at University of Chicago. So I spent a good 6 years there, um, grinding away in the lab.
Yeah, and so how was like the admissions process for you? You said it was like quite difficult with like research, but other than that, what was your experience with like applying both to med school and then the internal one?
Yeah, so and now I've seen it from both sides because I do a lot of admissions work for med school and for residency. And you get a lot of people trying to get the spots that you're looking for. And so you're looking for something that really stands out. Most people, it's almost formulaic the way that the letters are written. You know, people want to make a difference. They have a story, something like that. I will say that a lot of programs, particularly surgical programs for residency, really lean heavily on people who have a sports background because it shows their ability to, one, work in teams, which is extremely necessary in the hospital, but then also to manage time, to show leadership, to do a lot of traits that are really essential for medicine are really highlighted by playing sports. And so it's definitely a plus.
Mhm.
Um, but yeah, but it can be, I mean, you have to kind of, one, medicine is a very hard field to do if you don't love doing it. And so you should know, one, that you enjoy service, helping people, making a difference, that sort of thing. That's really part of it. And it is, it can be extremely exhausting. And if you don't sort of refill your cup by making a difference for other people, then you're going to burn out. And so, if it's really important to find reward in what you're doing, I would say.
Mhm. That's really good advice. Um, okay, so then you're at U Chicago, you're doing your MD and your PhD. Was it split up like the way, like the joint programs, like you did half of your MD, then you did your PhD?
Sure. Yeah. So at our program, it was you did the 2 years of classroom medical school. The first 2 years generally is classroom work, and then we went into the PhD portion, and then came back and went right into the clinicals at that. So that was actually interesting because I ended up in surgery, but I had done my anatomy class like in 1999, and by the time that I got to the clinic rotation, it was 2005. So it was like 6 years later. So that
Oh,
made it. It was
had
not
to refresh.
fresh.
Oh gosh.
Yeah.
So
Yeah.
yeah, how else was that experience for you, both in the med school and the PhD part of that?
Yeah. So I will say grad school is funny because depending on where you go, like it's sort of nebulous. You never know exactly when you're going to finish. And that can be at times actually a little bit depressing. So you're just grinding away, and you need kind of things to fall into place, and you're hoping against hope that it's gonna work out, and it does sometimes, and it doesn't always, but eventually you get through it. Um, the most important project that I did actually ended up being a side project that I was doing while I was doing my thesis work. They asked me to kind of help out on this other project using this mouse that had this overexpressed, or this knockout of a protein called PD-1 and PD-1 ligand, and we were able to demonstrate that if we did that, that the cancer that we would give the mice wouldn't grow; it would get rejected by the T cells. And for me, it was just wrote like busy work because I was doing all these other things. And it turned out that the guy that co-authored with us and collaborated with that, he won the Nobel Prize. It was this guy by the name of Hanjo, Dr. Hanjo, for his work in PD-1, which is now like a standard treatment. And I tell that story because at the time, I was just grinding away in the lab, and I didn't know that it was going to have any impact at all or be important in any way. And then 10 years later, our co-author won the Nobel Prize, which is like fairly amazing. And
Yeah.
so you never know when you're going to be making a difference sometimes. And so that's why you really got to put your effort into it. And sometimes these little things that you completely overlooked end up being like serendipitously the big story. So,
Mhm. No, that's insane. Um, so then you finished your MD, PhD. What did you do for residency after that?
so then I went back. So I was kind of bouncing back and forth between Chicago, where I was born, and California, where I went to college. So after college, after med school and grad school, I bounced back to San Francisco and went into the general surgery program there. It was exceptional. I think every level, I think you work with people who are extraordinary, and I think that is really like I don't know, you feel like you're walking on the shoulders of giants, and that is inspiring. And then you end up being a part of this legacy and this story, and that's actually pretty amazing. So it was, I mean, it's hard. I will say that general surgery residency is one of the hardest things I've ever done in a lot of ways. It's exhausting, but you don't ever wonder if you made a difference, because I think that a lot of people end up needing help, and you help a lot of people. So.
Mhm. What do you think was like your toughest challenge through residency? And like, how did you overcome it? It's probably broad, but
That was really hard. um, it's just exhausting. It's physically and mentally exhausting. I think you're always tired, but for me, the way that I got through it was that I always felt like all my friends were at work. And so if I needed to get up at 4 o'clock or whatever, that was fine, because I was going to go see all my friends. And that's kind of basically the way that it was. Because I mean, like residency, I didn't have too much time out of the hospital. So everybody that I knew was in the hospital. So I was just going to go hang out with all my friends for a couple of hours. And we were going to do things, but we were all going to do them together. So it was going to be fine. And so that's what it was.
no, that's a really refreshing way to look at it. I'm assuming you didn't have any time to be doing a bunch of research on the side while you were in residency.
So
Or
residency built so that it was set up for us. We had 2 years of dedicated time to do research in it. So it ended up being
oh,
7 years, but 5 years clinical. So I ended up doing some sepsis research in an animal lab. Yeah. And so I was able to do that, and we got a little publication out of that, and it was a good time.
yeah, and okay, so then after that, then you went on to your fellowship. And where did you do that?
I went on to University of California, Davis, where I managed to stick and stay. So yeah, went over there for fellowship, stayed there for a year, established my lab that I run now, and managed to stay on as faculty.
Yeah, and so tell us a little bit more about that, because now you're still there at UC Davis, and you run, from my understanding, two very successful labs. So yeah, how did that go for you?
Yeah, so I am a trauma surgeon and emergency general surgeon, and I do surgical critical care, meaning that I take care of surgical patients in the ICU. Uh, and so in that division, one of the reasons that I was hired was they wanted to get more of a national footprint by establishing a basic science lab. And so having an immunology background, we built a lab that looked at pulmonary thrombosis, inflammation, and clotting, basically in the setting of thoracic trauma. So that was my main research focus there. Um, Once there, also, I got involved in my other basic research focus, which is something that's completely unrelated, and that's hospital-based violence intervention programs. To explain what that means, uh, it'll take a little bit of time, but it's worth it. So,
Yeah, no, it's worth it. I think people will like this.
so right. So the analogy that I always give is if you have a heart attack, when you have a heart attack, acutely you go into the hospital and they do what's called a cath, and they run a tube in up through your cardiac coronary vessels, and they bust the clot out so that you basically get flow back to your heart to help it heal. But the story doesn't stop there. It continues on, and you get aspirin treatment, you get an exercise regimen, you get a diet plan, usually some weight loss, smoking cessation. There's a whole battery of things that you're armed with when you leave to decrease your chances of ever coming back. Historically, violence was not treated that way, but it can be. So historically, with violence, person got shot or stabbed, and they come in, they stop the bleeding, patch up the holes, and they send you out. But in that setting, you end up going back to the same exact risk factors that already demonstrated that you're at a high risk for violence. And so the chances of you coming back is extremely high, and the recidivism rate can be as high as like 60 to 70% sometimes over the next 5 years that you'll come back with another violent injury. If you take instead a more public health comprehensive approach and you start addressing some of the social determinants behind violence that exist in the community, and you don't stop care when the patient leaves the door, but instead you start changing the way patients navigate through the hospital and the hospital experience, and you help with legal help, and you help with safe housing, and you help with employment and educational opportunities, and you get people back in school, and you know, you address a lot of the factors that contribute to the violence, then you have decreased the overall violence in that community, decreased the chance that patient is going to come back, and that recidivism rate. And so the hospital is a perfect place to do this because oftentimes, you know, that's where people funnel to when they get hurt. They funnel to the hospital. So this is the opportunity to make the difference. And since about 2009, these programs have been started to be established, and they're really making a difference and an impact on the community. And not only that, but they're changing the way that the hospitals interact with the surrounding communities, and they're changing the way that the personnel in the hospital interact with their community, all in positive ways. So that's my other research focus.
That sounds like absolutely incredible. You're doing amazing work in both of these labs, and you're a surgeon. What's the balance like for you
Oh,
in like your work? How do you
cool.
do
It's
all
like,
of that?
yeah, there's a lot of juggling. And so you have to really be good at prioritizing what comes first. And you have to really make some decisions about what matters. I think when you first start as junior faculty, it's really hard to say no when people are sort of dividing your time and asking you to do a lot of different responsibilities. As you go, you begin to establish yourself in different areas, and you have to kind of really start to take back your calendar. And that could be hard. And it's also difficult because I think everybody kind of wants to do everything anyway, because it's, you know, it's nice to be involved in a lot of different areas, but you want to do excellent work in an area. So you do kind of have to find a way to take back your calendar.
Mhm. And what would you say though is like your favorite part of being able to of your position now, and like what your role in medicine is?
My favorite part is actually the interactions with my team and with my patients. I think at the end of the day, you have to have something that fills back up your cup and makes and is rewarding for you. And so for me, a lot of that is getting somebody home safely, or, you know, somebody who, you really can make an impact on people's lives. And sometimes you don't get everybody home, but sometimes the story is that you help somebody choose the way that they want to live and die on their own terms. And sometimes that's going to be the story. And that's part of medicine too. And so I think that's what it is. But either way, you get sort of all these amazing stories that you begin to accumulate that sort of follow you around, and they're really great, and they sort of fill you up and remind you why you do the work.
Mhm.
Ton of anecdotes. It's just
No, but they're good anecdotes.
yeah.
Another question I had was, if like, what is something that you wish you kind of knew, like at each step of the way? If you could go back to maybe like, if you could go back to undergrad you, or med school you, or residency you, what would have been your biggest thing that to tell yourself?
Undergrad, I would say I would have done things a lot more with a lot more confidence. I think that it's easy to be intimidated when you really don't know what's going on, but the thing that you realize is pretty much in undergrad and in medical school, everybody's sort of acting cool like they know what's going on, but most people don't. And everybody's sort of in the same boat about that. And I think that if everybody had the courage to just sit down and talk about what the frustrations and the questions they had were, they'd be surprised that they all had so many of the same questions. It's just nobody wanted to raise their hand. And so I would say that I would have approached everything with a little bit more confidence, both in the classroom and on the field as an undergrad. Medical school, I don't know, medical school is fun, actually. I really enjoyed, especially the first 2 years. It was just great. I will say going into it, the most important thing to know is don't get behind, because it is a flood of information. Basically, you cover in about 10 weeks the volume of information that you cover in about a year and a half of undergrad. And it seems a little bit intimidating and scary at first, but the truth is that everything that you need to learn, you're going to hear it at least 20 times. And so if you miss it the first time, you got 19 more shots. And so it's going to keep coming back. Residency, I don't know. I think residency is just basically make sure that you have time to sort of rejuvenate and heal. Self-care is really important in residency because it is tough. And so nowadays they're coming with a lot more emphasis on that than they ever did in the past. And that's actually a very positive thing. So, and then now, I don't know, I just say, just do everything with passion.
Mhm. Yeah, what do you feel like is your next step? Like, what do you see yourself doing next?
Oh, I kind of like what I'm doing now. I really want to kind of continue to make research strides, both with the basic science lab and the hospital-based violence intervention program. I think I would tell you that trauma surgery is physically tough after a while. Like the older you get, those overnight calls get a little bit taxing. And so,
One sec, I think I need to pause this really quick. Resume. Okay, sorry about that pause, but you were basically talking about continuing your research, going forward.
yeah, I think probably over the next 5 years, I'll begin to shift a little bit more towards research and a little bit out of the surgical realm, only just because I think I'm getting a little too old, but but I will say that but I plan on staying continuing to have a really aggressive research platform and continue to make an impact there.
Yeah, you have had such an incredible journey, and I can't wait for everyone in Ames to be able to watch this interview and also access you as a mentor during your spotlight week, and probably also after that too. But what do you think you can uniquely, like, what unique aspect of your experience do you think you can use to help mentor kids? And also, like, what specifically are you interested in, like, mentoring on?
Yeah, sure. I think that the things that I know the most about are basically, one, how to choose research like to do and that's going to be really productive for you. I think I have had some very positive and some less positive experiences that have informed me and shaped me and helped me to offer some effective mentorship there. Um, my pathway to the MD PhD program was a little bit non-traditional too, and so I definitely can speak about that. I will say about the MD PhD program, probably like 15 or 20 years ago, somebody asked me what I would tell them to convince them to do an MD PhD program. And my answer to them was, if somebody has to convince you to do an MD PhD program, you probably don't want to do it.
That's a good answer.
It's a long road, and so you got to have the love going in. I think that's really important. But I think that I can offer that sort of insight. I think also a lot of people that go into surgery specifically want to know a little bit about the pathway there. It's a little bit different than many of the other specialties, and we all sort of have different cultures. And I think that people don't really appreciate the culture part until they get into med school and they start to see that it's a little bit different. Surgery sometimes gets a little bit of bad name. People think it's rough. It's not. It's just different. We have different sort of expectations. Our culture is a little bit different because of the timelines that we're under and how we do things. And so it gets taught a little bit differently. But I think that there's this sort of myth that we're all egotistical and mean, and I hope to like disprove the myth once and for all.
I
So
think
yeah,
you're already doing a great job with this interview. That does not sound like you in any way, shape, or form. So yeah, thank you so much for joining us for this interview. And I hope everyone enjoyed it and is looking forward to your spotlight week. Thank you so
thank you
much.
for having me. Appreciate you.